So the idea behind this is it comes from a physical therapist who also kind of studied anthropology and how primitive culture slept before we had $10,000 mattresses and beds and all this stuff, right?
Okay.
There are basically three common postures that people slept in. One, you see it in children, I see it in my kids now when they're cold. They tend to sleep in this kind of huddled position, with the theory being that the shins and the forearms have very little sensitivity to the cold and then kind of cuddle up, right?
Okay.
Another posture, and this is the one that we're going to work on. So you lay on your side, you bring the bottom knee about hip level, top knee about halfway up, your shin just kind of lays in the arch of the bottom foot. Pretty comfortable. Most people can get into this position just fine.
Every night.
Phase 2 of that would be your bottom arm comes through, and so now I'm in this position where I'm basically just listening to the bed, the couch, the floor, wherever I am. This starts to twist the spine, but the spine is straight, and the idea is that that starts to bring that shoulder girdle back where we want it. Phase 3 would be kind of lengthen the spine. I rotate, and now my right ear is flat on the floor. Both of my eyes can see. I'll spin around. So both of my eyes are visible. And I'm just kind of in this relaxed position. Most of the time, if somebody can get to this, it's just tight and it's hard to breathe. And so you relax here, you take a couple deep breaths, you expand the ribs, maybe you reset, you relax. This position for 2 to 3 minutes a night, and then you switch and you hit the other side. But the idea is that puts the spine in a straight but rotated position. The spine responds really well to rotation. Sometimes it has a little trouble with like flexion and side bending, but rotating works really well. When I just did that, for example, I got a little adjustment, a little pop, didn't hurt, just felt good, you know. If I do that every night consistently for a week or two, no more pops, no more adjustments, and it's just relaxed. If I don't do it for like 3 months, you're lucky if I can get halfway there and I'm staring at the ground. But in terms of what that does for the shoulder, for the posture, for the stretches the hips, stretches the spine, stretches the neck, stretches everything, that's like my one go-to when I'm looking for something for a person at home to be like, do I have full range of motion? That would be your self-assessment. You know, we talked about this position, circle, hands down, elbows down, relax, no resistance. Bumped tight through the shoulder girdle. It's like, I can't get it back. But if I relax, it just comes right back there. This is one self-assessment I use, and this is one self-assessment I use. So let's give it a shot.